This video will cover a vertical mattress. So as demonstrated here, what happens with the vertical mattress is you enter your patient, and again, you're going to need to be now a little bit further back. If this was your wound depicted, you need to be even further back from your wound, say approximately 7 millimeters. You're going to enter the patient, come out through the wound, enter back into the wound, and again come out of your patient, still about 7 millimeters back from the wound edges itself. You're going to flip the needle around. Again, this is another time where you're going to be operating away from you. Re-enter the patient, coming through the wound and exiting the patient with the knot being tied on one side. You'll see a small little line on the contralateral side as well as the suture itself. So vertical mattress is great for any area where you think you need a little bit deeper closure. This wonderfully everts your wound edges, but it just allows for that slightly deeper suture because you do have essentially two layers, 1 and 2 of closure for your patient. Areas that I love to use this suture, in addition to some simple interrupted sutures, are on the thenar eminence, the palm of the hand. So if you have a laceration through the hand, typically both the distal and proximal areas are a little bit more shallow. They're typically more superficial. However, this muscle here tends to become involved, case in point, with any type of boxer cut injury that occurs around the holidays. And therefore, I like to throw a few vertical mattresses in that area just to approximate that tissue underneath better. This is not a substitution for a 2-layer closure. So if your patient truly has a laceration through the fascial plane, if you believe that they need 2 layers of suture closure, you need to do 2 layers. But you think there's areas of the wound that are slightly deeper, or that you want to have better eversion of the tissue, a vertical mattress certainly helps you. So how do we do this? And again, here we have a 4-0 suture. This is going to be a nylon monofilament, and we're going to be removing this. So if here is your laceration and your wound, you're going to want to go further away, and therefore further away as you exit the wound. You're then turning the needle around, going proximal to the wound as you re-enter, and exiting the wound again proximal. So the goal is to keep everything relatively symmetrical, side to side. So as we enter the wound, again, perpendicular fashion, you chose that needle for a reason. I will say sometimes it's a little bit more difficult if you really selected a small needle because you didn't pick the right arc. You didn't pick an arc that's going to allow you to really be further away from the wound edge itself. Pick your needle, your skin up, go deeper on this area. It's difficult to demonstrate on the pad, but what you really want to get an understanding of is this is going to be now a 2, or I should say a 1.5 layer closure for your patient. So you do want this one, which is further away, to also be not only further away from the wound edge itself, but deeper to the patient also. Now, as we're going proximal to the wound, I don't want to be on the wound. I don't want to strangulate this tissue and cause an issue with regard to vascularity. Still want to be about 3-4 millimeters back from the edges of the wound itself, which ensures that you need to be further back as you exit the tissue. If you didn't do that well the first time, the problem is this area here will be very, very small, and that becomes the area that you actually use to remove this stitch from the patient. Go back in, throw your hand away from you, grab your needle, now you can do an instrument tie here, and classically if you're using this to suture a laceration back in place, you want to be sure that you have a lot of suture material. I like a one-handed tie. So we're going to do that today. We're going to then cut this similar to everything else, right? Go down to the knot, angle the scissors, and cut. Now, the nice thing is you can even tell how well those wound edges are everted, and you can supplement. Oftentimes, if I need to use a vertical mattress, the entire laceration does not need to be closed that way, although it can be. You can do a vertical mattress, simple interrupted, vertical mattress, and subsequently the same on the other side. I like to make the wound at least look symmetrical. Now, with regard to removing this suture, if your colleague has decided to place vertical mattresses and now you have to take it out, you're going to actually remove it from the side, not the knot side, so that you actually are dragging less material through the wound itself. So grab your suture scissors. You're going to pull up on this little teeny side here, similar to cutting your horizontal mattress. Cut that in half, and then again dragging it away from you. That way you're not pulling all of that material through the patient. So that's going to cover both placement as well as removal of vertical mattress.